Hello, I'm Dr. Kang Ji-sung, the hair wizard who protects your hair. It's a pleasure to be here. Having high blood pressure doesn't necessarily lead to severe or common hair loss. This is because you might assume that high blood pressure would lead to increased blood circulation. However, when we speak of hypertension, we are actually referring to elevated pressure within the larger blood vessels, not necessarily an overall increase in peripheral blood circulation throughout the body. So, I want to reassure you that having high blood pressure doesn't necessarily mean you'll experience hair loss. However, it's worth looking into the reasons behind your hypertension. There must be underlying reasons for high blood pressure, such as obesity, lack of physical activity, or even genetic characteristics. And stress certainly plays a significant role. Therefore, having elevated blood pressure is not a favorable situation. If you have high blood pressure, you should examine its underlying causes. Should any of those causes be contributing factors to your hair loss, you would indeed need to modify and improve those aspects. However, for elevated blood pressure, we typically advise exercise therapy and dietary changes, correct? You make some changes and then you start medication treatment. Honestly, blood pressure stabilizes quickly if you just take your medication consistently. I've thought about it. Why does this question keep coming up? The reason for this query is that we have a medication called minoxidil, used for hair loss. But this minoxidil, which is normally a liquid product applied to the scalp, was originally a blood pressure medication. It's a drug that's supposed to lower blood pressure through vasodilation, and it seems to be particularly good at dilating peripheral blood vessels, the capillaries. So, you're familiar with minoxidil, right? When taken, it causes fine hair growth, among other beneficial effects. Perhaps since taking blood pressure medication improves hair loss, people ask, is my hair loss due to hypertension? This suspicion strengthens, and this question indeed comes up quite often. They ask, my blood pressure is high, what now? Will I go bald soon? However, since there is no direct link, please don't be too concerned. Both high blood pressure and hair loss are treatable conditions, so I strongly advise you to consult with a doctor for proper diagnosis and care. Unfortunately, sometimes there's an underlying reason for having hypertension. Among those suffering from chronic illnesses, I frequently observed cases where their hair is thinning, its regrowth rate is slow, or hair loss struggles to recover effectively. Furthermore, I've often wondered if alopecia areata isn't a bit more common among my acquaintances. I once had a patient who had hard-to-treat hypertension from a young age, and he frequently developed alopecia areata. So, when I was examining a patient, the thought occurred to me that perhaps there was a disruption in the overall balance within his blood vessels and circulatory system. While this is just my personal opinion, not an absolute fact, if your high blood pressure is significantly high and unmanaged, you must find the cause. It could indeed be linked to hair loss. Today we've looked into the connection between hypertension and hair loss. Simply having high blood pressure doesn't automatically mean you'll experience hair loss. You don't necessarily need to worry, but having high blood pressure isn't ideal, so please find the cause and seek treatment. Thank you.